Hello everyone, thanks for joining us again. It's Sona here from Upgrade Your OET with Bose Learning, and I've got another vocabulary quiz for you and some speaking practice as well. And this time my quiz is all about floaters, and I've got 5 questions for you. What are floaters? What questions can you ask a patient who may have them? How can you reassure your patient about them? And also, how can you advise your patient on when it's important to seek help? And then finally, how can you explain to a patient about what they are? And this session is aimed at looking at everyday lay language, like floaters, looking at some questions that you could use in your OET roleplay, or that you may hear in an OET listening, or of course everyday life. We'll also focus on pronunciation and grammar. So what I'm trying to do here is just try and build your everyday healthcare vocabulary and help you with some OET practice. If you like these sessions, then please don't forget to click on the like button, share it with a friend or a colleague, and subscribe to us. Okay then, so first question, what is a floater? Now, just to remind you, I'm not a healthcare professional, I'm an English teacher who's had over 15 years of experience, and I'm a premium preparation provider of the OET. So all my medical knowledge comes from the NHS or other reputable sources, and I always put the URL down at the bottom here. And I'll also put it into the comments box below so you can check it out as well. What we're going to do now is look through the information which is presented in a really patient-centered manner. So these are the kinds of expressions you can use with your patient or that a patient may use with you. So floaters and flashes in the eye are these dots and lines, and that's what we call them. We call them floaters. Or you might experience flashes in the eye and your vision just has these little squiggles in front of you. They're not usually serious. They're normally harmless. They look, as I say, a little bit like this with little kind of black or coloured lines. They could be squiggly, which is this idea here. They could be ring-shaped or cobweb-shaped, or they could be little flashes of light. So for most people, it's not something serious, especially if you've had them a long time, they're not really getting any worse and your vision is not affected. So these are 3 things that you need to check with your patient to make sure that this is something that's either normal for them or something that isn't getting any worse. So what questions can you ask a patient in order to find these answers out and therefore then advise them? What about the first one? How can you ask them this first question? Well, you could say, how long have you had them? Something really simple. How long have you had them? We use a present perfect because we're connecting the past to the present right now. How long have you had them? Question number 2, are they getting any worse? So you're using present continuous here to talk about progression. Are they getting any worse? Pronunciation here, worse, worse. And the last question, what's your eyesight like in general? And are the floaters affecting your sight? So you can ask them about their vision generally and also particularly if the floaters are affecting their sight. Okay, how can you reassure your patient? As the NHS says, they're nothing that strange and they usually get better by themselves. So what can you say to your patient to tell them not to worry? You could say floaters are nothing to worry about and are quite common. They may eventually stop and often get less noticeable as you get used to them. Noticeable. Pronunciation, noticeable. However, sometimes they are indicative of something more serious, and the NHS advises patients to call 111. That's the non-emergency helpline. So if there's an emergency, such as a heart attack in the UK, we call 999. If you just want general advice about something you're not sure about, we call 111. So we have a whole list of bullet points here, but how can you put these bullet points into nice phrases to explain to your patient? Here are some ideas. Sometimes seeing floaters can be an indication of a more serious problem. If the floaters or flashes just appear suddenly or increase, or if you get a dark curtain-like feeling, a kind of shadow moving across your eyes, then you should let us know or call 111 immediately. So try and explain what's happening if they see this or they get this dark curtain or shadow moving across their eyes. They should come back and see you or call 111. Some other warning signs are, so here we go, we're signalling to your patient that there are some other things they should look out for, and they're warning signs. Some other warning signs are having blurred vision, so that's when you can't see clearly, or when you get a pain in your eye, or if they've had surgery or an eye injury and you get any of these symptoms, then it's really important to get it checked out. And here you're emphasizing to your patient that it's really important. You're stressing to them about the importance of getting this checked properly, not just ignoring it. Finally, your patient will probably say, okay, but what are they? And here are some examples of how you can explain what they are. As I mentioned, floaters are quite common, particularly as we get older. It's always nice not just to say as you get older, because we all do. So as we get older, you're involving yourself there as well. They're normally harmless, and they're usually just a process called posterior vitreous detachment, or PVD. Absolutely fine to explain this in medical terms. Posterior vitreous detachment. Just note this V, it's hard, V. Bite your bottom lip if you're having trouble with that. PVD. And then explain what it is in everyday terms. This is where the gel inside your eye changes. But, however, sometimes they can be caused by retinal detachment, and that's very serious. It can lead to permanent vision loss if it's not treated. However, most often they just happen for no obvious reason. Maybe you just rub your eye and suddenly you see these little squiggles. And I think that's happened to all of us. Okay, so those are some examples of what you can say to your patient or what your patient may say to you. I hope you found that little session useful. Don't forget to click on that like button, share this and subscribe to us, and check out one of our other videos as well. We've also got our on-demand courses, which are all pre-recorded and which you can watch in your own time at your own pace. And I've put in some discount codes for you in the comments box below. Thanks very much for watching. Take care and see you next time. Bye-bye.